Guys, after leaving the doctor's office, I really don't see any bruising on her thighs, but the doctor does. So this is a video recording, if you can see. Right here is an old scar from falling or a shot or something. Show you scars from shots. I don't see any bruising in the knee area. It's a little red, but so is her arms and everything, where she got blood draws, and she has red all over her skin everywhere, like little hematomas, which I believe is from a large dose of Motrin given to her at the hospital. They gave her about 3 or 4 cups of Motrin. They x-rayed the wrong leg. I'm sorry, Mama. Mama had to do this for proof. This is where I see the most redness on her leg, behind her left leg. And as you can see, she doesn't want me touching that. It's very painful to her. Next, I will show her arms around the IV site where it's blue. And then her arms got very red and broke out after the injection. About an hour after we got home, we started scratching. Okay, Mommy, I'm sorry. There you go. I'm sorry. Okay, let me see her arm, Mama. This is her arm where they took the IV out at. I don't know if you can see, but it's very blue and red and bruised. As you can see, there's red all down her arm from the arm. They took this out, and there's still a rash here on her arm. Her arm is very red. In fact, she's red all over, which I believe is from the large dose of Motrin they gave her. She has red all the way up her arm, where the tourniquet was on for her a very long time. It was on there while they put the tourniquet on her arm very tight. Then they started to cut the tape, place the tape on the table, get their bandages and stuff ready. I undid the tourniquet because after 4 or 5 minutes, I felt that was too long. Then he let it stay off for a minute. Her arm is swollen there too. Then he tried to draw her blood. He couldn't find the vein, so the tourniquet was on again for a very long time. Anyway, I'm saying all this because I believe that caused the redness on her body. And also, it probably introduced latex or something into her arm while he was digging around trying to find her vein. Maybe he hit a nerve, and that's why she's having so much pain. Here's the redness all over her arm from what I believe is what you call petechial hematine, I think it is. It first presented itself as swollen and itchy to her like a rash. So I gave her a little Benadryl, washed her skin down really good, and put hydrocortisone cream on her. The swelling has gone down. However, the rash has, as you can see, she still has a lot of redness. Her skin is very dry right now. I don't want to oil it and irritate it more. I washed her down with some ivory, like I said, and put the hydrocortisone cream on her. Not the ointment. If you can see all that redness in her skin. But you can see it all in her face too. It's everywhere. Anyway, that's our visit for today. I didn't see a very old, large bruise like the doctor says. And I'm just sending this out so everyone knows in case she does something she should not do. Also, because they gave her that large dose of Motrin, Journee had 2 bloody stools, very bright pink blood in her stools. So I fed her a lot of kale and a lot of spinach. I made it in salads with mulberries, grapes, apples, pears, prunes, and a few other things that have the kale and the spinach have a lot of vitamin K in them, and high doses of vitamin K helps with clotting of blood, to stop the blood. So this is what I am sending to you putting this online so everybody knows what's happened to Journee. Bye.